Are you aware of the direct impact climate change can have on your health? Join us as we are going to explore the link between climate change and human health, and also discover the essential strategies for adaptation to safeguard your well-being. So stick to the video till end and don't forget to like, share and subscribe to the channel. Hello everyone and welcome back to Climate Crunch YouTube channel. Today we have an important topic to discuss: climate change and human health, impacts and adaptation. In this video, we'll delve into the significant impacts of climate change on human health and discuss strategies for adaptation to protect our well-being. So let's get started. Before starting today's topics, first of all we have to understand the connection between climate change and human health. So climate change is not just an environmental issue, it also possesses significant risk to human health. The warming of this planet and the resulting changes in the weather patterns, extreme events, and the spread of diseases have profound implications for our well-being. So let's explore the key aspects of this connection. And our first topic is impact on human health. Climate change impacts human health in various ways, and it is crucial to understand these effects to develop effective strategies for adaptation and mitigation. So let's take a closer look at the impacts on human health. And now we have impact number 1 is rising temperatures and heat-related illness. As temperature increases, the incidence of heat-related illness rises as well. Heat exhaustion and heat strokes become more prevalent, posing risks to individuals' cardiovascular health and exacerbating respiratory conditions. Impact number 2: extreme weather events and physical injuries. Climate change intensifies extreme weather events such as storms, floods, and wildfires, which contribute to physical injuries. Disasters disrupt healthcare services, making it vital to have robust response plans and early warning systems in place. Next up, impact number 3 is air pollution and respiratory sickness. Climate change exacerbates air pollution, leading to increase in the respiratory illness like asthma and chronic obstructive pulmonary illness. This calls for reducing greenhouse gas emissions to mitigate the air pollution. Next up, impact number 4: vector-borne diseases and changing disease patterns. Climate change affects the distribution and behavior of disease vectors such as mosquitoes and ticks, expanding their range. Consequently, diseases like malaria, dengue fever, and Lyme disease experience increased transmission rates. Next up, impact number 5: mental health and psychological impacts. Climate change has substantial implications for mental health, including anxiety, stress, and depression connected to climate-related events. The emerging concept of eco-anxiety highlights feeling of helplessness and distress about the future of this planet. Displacement and loss of homes due to climate-related factors can lead to trauma and emotional distress. Now moving on to the next segment, our next topic is adaptation strategies. So we can say that adapting to the health impacts of climate change is crucial to protect our well-being and build resilience. So let's explore some key strategies for adaptation. So adaptation number 1 is strengthening healthcare system. In order to adapt to the health impacts of climate change, several strategies can be employed. First of all, strengthening healthcare system is crucial to handle the increased health burdens resulting from climate change. This involves investing in healthcare infrastructure and allocating resources to meet the growing demands. Next up we have adaptation strategy number 2, heat wave preparedness. It's another important aspect of adaptation. Developing early warning systems and heat wave response plans is crucial to protect vulnerable populations from health risks associated with extreme heat. Furthermore, implementing heat mitigation strategies in urban planning and design can help reduce the urban heat island effect and create cooler and more livable cities. Next up, adaptation strategy number 3, improving air quality. It's a key adaptation strategy to mitigate the health impact of climate change. Reducing greenhouse gas emissions is crucial in combating air pollution. as it contributes to respiratory illness and other health problems. Promoting cleaner energy sources and transportation options can help decrease the emission of pollutants, improving the overall air quality and safeguarding the public health. Next up, we have adaptation strategy number 4, disease surveillance and control. Disease surveillance and control are essential in adapting to the changing disease patterns influenced by climate change. Enhancing surveillance system to monitor vector-borne diseases such as malaria or dengue fever allows us for early detection and intervention. Implementing vector control measures such as mosquito control programs and raising public awareness through campaigns are crucial in preventing and controlling the spread of these diseases. Next up, last but not the least, our adaptation strategy number 5 is mental health support. Mental health support is a critical aspect of adaptation to the health impact of climate change. Providing access to mental health services and support networks is necessary to address the psychological impacts associated with climate-related events. Promoting community resilience and social support system can help individuals and communities cope with the stress, anxiety, and trauma induced by climate-related events. So that's it guys, that's the wrap up of this video. Climate change has far-reaching impacts on human health, affecting both physical and mental well-being. By understanding these connections and implementing adaptation strategies, we can protect ourselves and build resilience in the face of changing climate. So thanks again, thank you all for watching this video, and don't forget to like, share and subscribe to Climate Ground YouTube channel for more informative videos.